get started because I just have some announcements and things like that. But let's see. First of all, welcome everybody. This is our fourth Essentials session of the year. It was going to be our second one, and we wound up having high COVID numbers the week we were going to be in person, and it happened to be one of the hottest weeks of the summer. So I think quite a few of us are probably glad that we are sitting here in our living rooms or wherever we are right now. So welcome. I'm glad that you're here, and welcome to our speakers. And I also want to introduce you to a couple of our board members who are here. And if you all want to say hello or anything, I don't think Sam Kabady is back. He is a law student and he is ducking in and out from a class tonight. Mark Long, would you like to say hello?
Good evening, everyone. Glad you could join us this evening.
All right, and Karen Tome.
Yeah, I'm very glad to see you guys.
Okay, great. Well, thank you both. So Envision Frederick County has been around for 10 years, and what we focus on is having making sure that our community is welcoming and environmentally sensitive, and that we practice good land use, and we are increasingly wanting to understand how our focus on these issues, as well as citizen transparency, are equitable to all citizens. We've always had a focus on these environmental and land use issues and don't always think about how they may play out in terms of their impact on all socioeconomic, ethnic persons in our community. So when we held Essentials last year before the pandemic hit, we were able to do one session, and we did have one session on this topic, but we're not able to dig in further. So this year we said we wanted to hear about impacts of COVID or housing or whatever the issues are on communities in Frederick County. So we have recruited a stellar set of speakers here who are with us tonight. And what we're going to do is have a speaker and then have a couple of questions. Ken is going to be giving us a bit longer of a deep dive into the latest ALICE report, and then we'll be having reports from our other speakers who are a sort of panel if we were all together, with a little bit shorter report and then a little bit of time for discussion afterwards. So, and this is 6:30 to 8. I know weeknights are tight for people. What we've done in the past is gone around and introduced ourselves, but I thought I would try to keep the time frame tighter today so that people could get dinner and get kids to bed if that's where you're at. So there's going to be a lot of time for questions and answers, and hopefully you'll introduce yourself, where you're from, or what community, part of the county, and give us a little context when you ask questions. But you're all welcome to stay on camera if you like. If you don't want to, that's fine. We are recording this meeting, as you probably were notified when you came in. So if that's a problem for you to be on camera, then that's fine. You can stay off camera. So with that, hopefully I haven't forgotten anything here. But do put your name on screen. I think most people have their name there already. So I'm just going to go ahead and get us started with an introduction of Ken, who is our first speaker. And Ken has been president and CEO of United Way of Frederick County since August 2016. And he's responsible for the development of the organization's long-range vision and developing the business strategy to advance the organization's objectives. Before United Way, for nearly 15 years, Ken was the president of National Philharmonic at the Music Center of Strathmore in Bethesda. He serves on several boards of directors, including chair of Frederick County Coalition for the Homeless, and is president emeritus of Frostburg State University Foundation, where he received a Bachelor of Arts at Frostburg. In recognition of professional excellence from that university, he received the prestigious Alumni Achievement Award. And Ken grew up in Tawnytown, but has lived in Frederick County since 2005. So we are very lucky that we are going to get a personal account of a report that I've read about in the newspaper. So take it away, Ken.
Thank you so much. Linda, if you can pull those slides up, then I will
doing that.
do some introductory work here. Well, thank you. I'm so honored to be here to speak with you this evening. I think we had all wished that this was going to be in person, and gosh, I would have loved to have seen many of you who I've gotten to know so well over the last few years here at United Way. I would have loved to have seen you in person, but alas, here's where we are. You'll have an opportunity to hear from Danielle a little bit later, who I'm sure will be talking about vaccinations and our need to continue to promote vaccinations within our communities. I will not be speaking as much about that, but I will be speaking about critical equity issues in Frederick County that are really at the basis of what the Alice report is all about. Let's go ahead to the next slide, please. The way that we're structured, Linda, I believe, is I'm going to be speaking for about 15 minutes, so I'll have to move pretty quickly through all of this, but there'll be plenty of time for questions, and please feel free to put questions in chat.
Ngàn 860 một tháng coi như là một
Excuse
năm
me,
là cũng được
if everybody else could go
chưa có đóng
on
đồng
mute.
nào hết phải không?
Yes,
Chưa có đóng
please,
đồng nào thì bây giờ mình có thể gửi cái check lên khoảng 2.000 lên cho người ta đi.
Linda, you may be able to mute
Yeah.
on
Hold
your
on one
side.
second.
Ok, xong rồi là
Thì để em làm cái form đó cho anh, ok? Em làm cái form đó cho anh rồi em gửi cho anh in ra là anh kẹp cái tờ giấy vô anh đi gửi thôi, anh gửi thư thôi.
All right.
I think
Sorry
we got it.
about
Okay,
that.
very good, very good. So
Took me
here's
a
what
moment.
here's what we're going to cover very quickly today. Or you can skip this. Those are our sponsors. We can skip those.
Okay.
we love them to death, but they're not the heart of the presentation. So here's what we're going to be talking about today. We're going to talk a little bit about who United Way is, just as information. We're going to review the Alice report, and then we're going to wrap back around and talk about some recent data that we have come out with, and that's the Alice Impact Survey. And please, if you can ask questions at the end of the presentation, I will add, if you want to throw some things in the chat, we can, while you're thinking of it, we can catch those at the end. And then I can also, when my presentation is finished, I can come back and answer questions on chat as well. Let's go ahead. So let me speak very briefly about United Way. Our mission is to fight for the health, education, and financial stability of every person in our community, especially those who are unable to afford a basic cost of living. Next slide, please. So I want to speak very quickly about our diversity, equity, and inclusion mission that has pre-existed for many years, the COVID pandemic, but we actively oppose all forms of discrimination. We value and embrace what makes each person unique, and we focus on improving conditions for Alice, and it's because they are those who are unable to afford that basic cost of living. Next slide, please. So what is Alice? So Alice stands for Asset Limited Income Constrained but Employed. These are working families who are unable to afford a basic cost of living. Next slide, please. So we're going to be looking at a number of things here. So it's an analysis of those who basic cost of living. These are families who in normal conditions, and I need to highlight normal conditions, make tough choices every day between basic necessities. And the reason why I want to highlight normal conditions, because these ain't normal conditions. So we'll talk a little bit more about that. Alice provides critical information about the financial stability spread across all of our community's demographics. And I want to make a key point here that this is the Alice report data that we're going to be talking about now is from 2018. That seems old these days. It was released in 2020. There's always a 2-year lag, and recognizing that it did not take COVID impacts into account, we have recently released information on the using a COVID impact study that brings it somewhat up to date. And then in 2022, next fall, a year from now, we'll be releasing the next hard data Alice report that will have that really critical information, and will incorporate COVID impacts at that time. Next slide, please. So here's what we're going to talk about. We're going to talk about our basic cost of living in Frederick County and how it's changed over time. We're going to talk about how does the basic cost of living compare to the federal poverty line, the percentage of Alice households who qualify as Alice, and then key to this conversation is segments. What segments are what population segments are most affected. And then I'll add in another, we're going to talk about the COVID impact survey as well. I'll be moving pretty quickly from here out. So bear with me, write your questions down as we go through. So right now we're looking at the chart for the United States of America. We present this for the entire United States for two reasons. First, we need to understand that 43% of Americans are unable to afford a basic cost of living. That's 43%. But to also give you an idea of what the charts from this point forward are going to be looking like. They might be horizontal instead of vertical, but always the poverty level, those who are considered by the federal government in poverty, will be in red. And then depending on your eyes, that's either orange or yellow. Today it looks more orange on my screen, but who knows on yours. That is the Alice threshold above the poverty, the federally defined poverty level, but below what we call the Alice threshold. That Alice threshold is the basic cost of living in the community. So they're below a basic cost of living and above poverty. Generally speaking, when we have the numbers, we're considering those that are Alice are below the Alice threshold. Next slide, please. Oh, there we go. Excellent. All right, so here's the same chart for Frederick County. So what this chart is saying is that it's 37% of our community in Frederick County is unable to afford a basic cost of living. Living. Of course, 6% of that is poverty, and then 31% above the poverty line, but below that basic cost of living in our community. 37%. Here's what that has looked like over time. So this is particularly meaningful to us at United Way, because in 2018, that was the first time that we had actually seen a reduction in the total percentage of the community that was considered Alice. And we were very excited to see this because we felt like, hey, we might be making some progress. The Alice report might be having some effect on the community. And then about 4 months after we released this report in 2020, COVID hit, and we're throwing this all out the window because we anticipate that the numbers will be dramatically different in the upcoming report. Next slide, please. So go ahead and hit the space bar twice, please. There we go. Okay, so what is the basic cost of living in Frederick County? So for a single adult, you're looking at $47,000, and this is a substantial change from 2 years prior. We're looking at a cost of living inflation level of around 5% a year, and most of that is property value increase, and we've seen it more this last year and a half than we have in other years. Property values have been really skyrocketing for quite some time. I'm sure Mark Long can speak for all day about such things, multiple days probably. And then for the family of four, we always tend to look at the family of four, 2 adults, 1 infant, 1 preschooler. I should note that we can create a survival threshold budget for any size family. We have a formula that we can put together. We typically look at these 2 single adults and 2 adults with 2 children. For the first time in the Alice report history, the basic cost of living for that family of 4 has superseded $100,000. And that is a symbolic and also meaningful increase to the basic cost of living. Most people are surprised when they see this number. So that is a basic cost of living. Next slide, please. So let's take a quick look at what the federal poverty level, what the federal government considers the federal poverty level. So according to the federal government, that single individual is in poverty if they make $12,000 or less, or that same family of 4 at $25,000 or less. So here's the problem. A couple of issues is that is that the federal poverty level is geographically ubiquitous. There is no geographic differentiation between Manhattan, New York, and Cumberland, Maryland. Federal government considers the poverty level the same in those two communities, and we know that those two communities have a very different cost of living. This is where the Alice report comes in. It says, okay, that's ridiculous. Of course, Manhattan is more expensive than Cumberland. Let's figure out what those levels are. But the meaningful difference is that there's a $35,000 gap for that single individual. And many, if not most, federal government assistance programs for those in poverty are available up to 200% of the federal poverty line, which would be about $24,000 for that single individual. And even if you were to take that into account, there is still a substantial gap between those programs and the basic cost of living, which essentially means that a large subsection of our community is unable to afford a basic cost of living, but does not have access to assistance programs through the federal government, state of Maryland, and the state of Maryland, and in many cases through the county as well. Next slide, please. Good. So here's some other basic data. I'm going to skip this slide only because most of this has changed so incredibly much that it's almost not worth looking at right now. For example, the housing burden of 30%. We're looking at so if you owe more, if you're paying more than 30% of your income on rent, you're considered housing burdened. I actually, a good question for Mark. We'll have to come back to. Now, Mark, I'm going to throw a question to you at some point that says how has this changed, or if there's any relevant data more recent than what I have on this. We'll wrap back around to that. Next slide, please. Okay, so now we're going to start getting into some of the geographic information. So essentially, the Alice report breaks everything down by geographic location. So we know that 37% of the community overall. How is that breakdown by municipality? Well, I don't think there are any surprises that Urbana and Adamstown are very low in the Alice percentages. Many folks are surprised, not that Brunswick, Fairmont, City of Frederick, and Emmitsburg are higher than Adamstown, but just how much higher they are is often a surprise for most audiences. So we're looking at roughly half of those communities unable to afford a basic cost of living, most notably the city of Frederick, with the largest population size, 27,000 households. Half of those households are unable to afford a basic cost of living. But that's not to say that most households live in the city of Frederick. Go to the next slide, please. This is very important for us to understand. So what this chart shows on the left-hand side is the Alice chart for the city of Frederick versus the rest of Frederick County. And what this shows is a vast majority of Alice households live outside of the limits of the city of Frederick, which is something that has changed the way that many of our countywide decision makers look at poverty and basic cost of living in our community. Next slide, please. So we break it down by age. Here are our age demographics. Most people are shocked by the 83% under 25. I personally am less shocked. I know that when I graduated from college, I was very, very poor for at least for a period of time, and was probably an Alice household probably up through about 25, probably closer to 30 actually. So I don't think that's necessarily surprising. There's relatively few households. We're looking at about 2,500 of these households in Frederick County. And note that this is not Johnny living in mom's basement. These are all emancipated households. So these are independent households living outside and independently of their families' homes. Of much more serious concern is the other side of this chart, which is at the over 65 population. And this is where equity starts really mattering. So we're looking at 47% of those over 65 are unable to afford a basic cost of living. And perhaps even more meaningful, that this number is growing not only in percentages every time we release report, but in the number of Alice, in the number of the size of the population. So it's growing as a percentage and growing as a population, which is particularly concerning and something we all have to be thinking about. Next slide, please. Among the more tragic information that this report contains is the fact that 79% of single mothers, almost 80% of single mothers are unable to afford a basic cost of living. That is something that should concern us all. Next slide, please. So we have always tracked and will continue to track how the costs, how ALICE levels are dispersed across our racial demographics. And indeed, we do this year as well. So you will see that Hispanic population is at 57% unable to afford the basic cost of living. Maria, I know it, I can hear it. I can hear her saying when Maria speaks, she's going to say that doesn't account for the entire Hispanic population, because there are many multi-family households that are very difficult to count. She is absolutely correct, and I'm sure she will discuss that in more detail in her section. African Americans at 40%. These two populations have often ebbed and flowed at the same rate. This time, for the first time since we've released this information, Hispanic populations are beginning to separate, beginning to get larger at a faster rate, and it's similar to seniors in both percentage and in the size of the population. Similarly, Caucasians and Asians have often fluctuated at the same rate. In this case, Asians are now separating from Caucasians and growing at a faster rate as a percentage as well. Next slide, please. So here's a fascinating data point that's important for us to understand about our community when we look at Caucasian versus total households of color. It's important for us to understand how this spreads, and this shows that while 47% versus 35% of households of color and Caucasian households at 35%, but the Caucasian population in Frederick County continues to be substantially larger than households of color in our community. So this is just important data for us to have and to take into consideration. Next slide, please. Okay, so COVID-19 and Alice. Next slide, please. So we have a number of data points in the COVID impact survey that we are look at fairly regularly. You will see here a number of data points about the overall survey results. We did survey the entire county. We had just shy of about 800 respondents of the county spread across. Most of those respondents, 67%, were above the Alice household, but we were able to thankfully pull in enough below Alice threshold households to be able to put together a firm report. As you see there, the survey heavily skewed to females who responded at a much greater rate. Yay, ladies, thank you very much for that. And a number of the data points that is available elsewhere in the report. Next slide, please. Good. So now we're getting in. This is now in the COVID impact survey. So this is much more timely information based on. So this was it was gathered in April and May of 2020 and released in August. So we're going to take a little bit look at here at this data. So interestingly enough, there's only one data point on this chart. So the answer, the question here is what are households' concerns? There is only one data point of all those collected in which above Alice household, those families above the Alice household actually responded at a higher rate or indicated at a higher rate than those who are Alice, and that is contracting the virus. Almost all households were concerned about contracting the virus, and actually above the Alice household, above the Alice threshold at a higher rate than those below. Mental health issues were a major indicator and a sign of needed work in the mental health area. Both Alice and above Alice were very concerned about this. The separation between these two groups really started to occur around paying household expenses, paying off debts, and sadly, having enough food. A substantial difference in responses for having enough food between those that are above the Alice households. Those are the lighter gray color, and of course the blue above the Alice threshold at 34%. Also, reduction of work hours. Our Alice households were much more concerned about reduction of hours and wages and loss of a job. Next slide, please. So this question is, what areas did your household have trouble meeting? So trouble meeting the following needs. Again, food needs really pop out as those critical as a critical area for Alice households, and much less for those who are not Alice. Housing needs, so our affordable housing that we continue to talk about and need to address, healthcare needs, childcare, technology, and then if you look on the far right, no difficult meeting basic needs. That the question heavily skewed towards above the Alice threshold. Next slide, please. So here we are looking at the actions that your household has actually taken. On the far left there, you're looking at taking money out of savings. Again, food pops out as a major need in all of these surveys. Our Alice households were much more likely to receive food from a food pantry. Another indicator in the report showed that a substantial portion of Alice households were receiving food from food pantries for the first time. Increased credit card balance, unemployment, applied for government assistance. Look at that, 24% versus 1%. And I have to say that these are government programs in which one had to apply for, not those that were automatic, like some of the checks that many of us received in the mail. Borrowed money, sold cash, sold belongings. The long story short, from all of this work on the impact survey, is that there is really the tale of two pandemics. Our Alice households were much more likely to suffer the severe economic consequences of the pandemic versus our non-Alice households. Next slide, please. So there is some United Way things here I'm going to go through very quickly. We have responded with the emergency relief campaign. We raised about $300,000 and between that and the Unity campaigns, and distributed those monies to the nonprofit community to bring relief to Alice households. We have been part of the vaccine task force. We have had free vaccine rides to anyone in Frederick County who needed a ride to get a vaccine. We know there were a number of barriers, continue to be a number of barriers. We wanted to eliminate at least transportation of one of the barriers to get a vaccine. And then, of course, we are focusing on our Prosperity Center's pathway to financial stability, which is a way that we know we can work with Alice households to move them into a non-Alice condition. For the sake of time, I'm going to stop here. I am happy to take any questions about the Alice report.
Wow, that's all I can say. I will not take time to talk. Who wants to ask a question? Anyone have a? Brian?
And does the I believe I know the answer to this, but I want to confirm. The numbers in the Alice report, that is pre-assistance, correct? Any sort of state or federal aid or service programs?
That is correct. So the Alice report is an analysis of the basic cost of living, regardless of financial assistance.
Okay, thank you.
Yeah.
Other-
Some financial assistance programs would count towards the income portion of it, but that would be after the analysis.
While we're waiting for another question, Ken, will we be able to have your slides, and do you have a copy, a link to the report that you can send?
Yes. So both. So I will send the link to the report. I'll put it in chat as soon as we're finished with questions.
Okay. Anyone else? We'll have some questions at the end too.
Excellent. I'll stick around.
All right. Thank you, Ken. Wow, that was discouraging. Good work that you're doing, though. So our next speaker is going to start bringing us into some of these areas that Ken talked about, and we're going to hear from Maria, who is the Executive Director of the Spanish-Speaking Community of Maryland, which is a nonprofit organization that strives for equality and sustainability for those who suffer in silence so that they may be able to reach and enjoy the socioeconomic level necessary for self-sufficiency. And I'm actually, what I'm going to do is send you all the bios after. I probably should have done that before, because I'm sure you'd rather hear from Maria than hear me read her bio, because I think she's very well qualified. So let me go to your presentation, Maria, and get you set up. All right, can you all see that?
Thank you so much, Linda. I appreciate it. Good evening, everyone. It's a pleasure to be here with all of you. I think Linda just covered this slide, so I'm going to ask her to move on to the next slide, please. Just wanted to cover just a little bit about what the Spanish community actually does and who the clients are. We serve low-income immigrant families, those that are experiencing homelessness, those who face uncertainty, multifamily living, trauma impacted, fear of daily life, trust issues, cultural challenges, language barriers, and separated from loved ones. Next slide, please. Just wanted to take a moment to go over some statistics from the 2020 government census that I think are crucial for people to know if they already do not know this. Between 2010 and 2020, the Hispanic Latino population grew 23%. In comparison to other populations, they grew 4.3% since 2010. Slightly more than 51% of the total US population growth between 2010 and 2020 came from the growth of Hispanic Latino populations. Also increased by the children between 2010 and 2020 from 23.1% to 25.7%. Maryland is now the most diverse state on the East Coast. The Hispanic population rose 8% in 2018 to 12% in 2020. And Howard and Frederick counties had the highest percentage growth, about 16% both. Frederick population grew from 233,000 to over 271,000. And Maryland now has a white population of about 47% compared to 55% back in 2010. So I think those are statistics that kind of lead me into the next slide that I'm going to be talking about. First, I wanted to talk about a little bit about COVID challenges facing the Hispanic community. As many of you know, the vast majority of the Hispanic community tend to have positions that are either landscapers or restaurants or things of that nature. So they were significantly impacted by COVID. A lot of them were unable to receive any kind of government benefits. A lot of them lacked medical assistance. They faced evictions for multifamily living arrangements because although there was a moratorium for a period of time, some of them rent rooms. There are families that we have, there were 4 or 5 families living to a 2-bedroom apartment. So a lot of times the pressure of the landlord not being able to collect the money forced them out of their living situations. Single mothers were petrified because if something happened to them, who would take care of their children? they were fearful in general of getting tested, because if they tested it and they were positive, that meant that what little hours they had to work, probably they could not attend work. All this erupted into more mental health issues, anxiety, depression, and trauma, more alcohol abuse, and more domestic violence. Children not completing assignments or attending school, dropouts. We saw a significant amount of children that were not attending school during this period. Also, the myths related to vaccine, that would be a chip inserted into you through the vaccine, and potentially they could track you everywhere that you went. So these are some of the challenges that we saw as we worked with our families through this COVID challenges. Next slide, please, Linda. In general, obstacles of the Latinx population, again, I mentioned lack of health insurance and lack of medical care. Unaccompanied children that come to the United States and are actually paying rent. We have had clients as young as 12 years old paying $600 for rent. Low wages and multifamily living. Again, like I mentioned earlier, the types of jobs that they have, landscapers, housekeepers, construction, restaurant, vulnerable positions. And also at times, they're not even paid minimum wage. They're fearful of being terminated from work, fearful of getting sick, fearful of going to the doctor. We have had many cases when people have gone just to the doctors and they have gotten fired just because they didn't come to work. Again, lack of benefits, which I mentioned before, and the medical costs. Only in extreme cases do most families seek any type of care or have a primary care provider. Also lack of pay, depending on the situation of the families. Next slide, please, Linda. Just wanted to share a little bit about, one family, one Frederick, things that come to mind. Spanish culture is more based on personal interactions and relationships. Cultural competence requires that one examines their own thoughts and feelings. I know that sometimes people hear things about different cultures, and sometimes we just need to really investigate to have a better understanding of how rich and how wonderful different cultures are. Sometimes we all have to look at our own cultural baggage and see if we have preconceived notions about a certain, racial group or a certain religious group or something of that nature, and kind of separate that and get to know different cultures, because it can be so wonderful to really understand and be able to speak about different cultures. Good and bad people exist in every country. The US is comprised of hardworking immigrants. I am myself an immigrant. I came to this country when I was in second grade. I came as a refugee from Cuba, and I was able to establish myself. I consider myself an American, because if you took me now back to Cuba, I probably wouldn't even know where to start. So I am very grateful that I am an immigrant. I'm very proud to be an immigrant, but I'm also very proud to be an American citizen. Breaking down information when talking to other cultures, paying attention to your audience and educational level when providing information. And one that is dear to me is better data. Social demographics delineation to help guide effective and strategic interventions and deployment of resources to communities. As Ken mentioned earlier, some of these reviews that are done or census that have been provided really do not show the full picture of the Hispanic community. There's a lot of fearful factors, and people tend not to want to respond. So there's damage associated with that, because we're not really able to track properly how many individuals are actually in the country, or how many individuals fall into the different categories that Ken alluded to in his presentation. So hopefully we can remove those barriers and remove that fear factor so that we are able to have better data. Next. Are there any questions?
I have a question.
Mm-hmm.
Okay, so you talked about a lot of the fear that a lot of people are facing because of COVID, right? And then there's a fear not just from the disease, but also because of misinformation around vaccines, right? Now, I remember, like, throughout this very, very long pandemic, we've had a lot of conversations about vaccine hesitancy, and oftentimes minority groups, whether they be Hispanics or Latinos, Latinx, or the Black community, have been like, oh, vaccine hesitancy. And I don't know if that's, like, do you have hard data to show, like, I mean, I know you have individual cases that you've spoken to, but do you have hard data to show that like X% of the population had these fears or subscribed to these like these misinformations and rather than just because I don't know, I feel like out in the ethos people are like, well, those brown people, they believe all the wrong things, right? Yeah, and I'm worried about that, right? Because I don't want people to assume that just because you're Black or just because you're Latinx that you just think science is like not real, right?
Right.
You know, you get what I'm saying, right? Okay.
Right. So there's a percent. I mean, the information that we have is the clients that we contacted during the pandemic. We actually set up a wellness check. When we started calling individuals, we work very closely with families from the school system. So we started calling families and trying to find out information, sort of like, what we called our wellness check. How are you doing? What is it that you need? Is it food that you need? Are you looking for employment? Are you going to get vaccinated? So we had the yes, the no's, the maybes, and a lot of them responded back at the beginning of the vaccine is just out. We're not sure. We want that vaccine to kind of go to several people before we even think about it. We've also worked the food lines over at Home Depot where the vaccination's working with the health department very, very closely. And a lot of people are very hesitant because of what they've heard in the community. But that doesn't mean that everybody has not gotten vaccinated. It just means that I think it's gotten better as we have progressed on with more information, but there's still people that are hesitant to get the vaccine. And I think that will continue to improve as we get more information. So to answer your question, I don't have an exact percentage. I just have the information that I have gathered by talking to people.
Now, as a follow-up, would it be of use for someone, if not your organization, to collect depersonalized data of that, like to do a survey, to do a poll, or to have data to say, like, yes, this is a concern, this percentage of the population, have these concerns, have these hesitancies, but it's not, you can't use it to form a stereotype or something like that. Would that be of value, or would that just like, mission, you got to focus on the mission first, right?
Right. So, I mean, yes, you have to focus on the mission. I think it would be very helpful. And maybe, I am not the health department. So maybe, Ms. Haskins, who's going to be talking about from the health issue, she might have better statistics associated with that, because they do track people that have actually gotten the population, people have actually gotten the vaccines. But I think it would be data that would be very helpful, to be honest with you. I agree with you.
We have time for one more quick question from Maria. Anybody else? Okay, so moving over to another community that we want to hear about, we're going to hear from my good friend Elizabeth Chung, who is from Hong Kong, China, and came to the United States in 1970. And we all know her very well as the founder and executive director of the Asian American Center of Frederick, whose mission is to support immigrants with essential skills to be independent and successful contributors to the community. So Elizabeth, I don't know if you have a presentation or you just want to talk from the heart, but go ahead and take your 10 minutes. And you're muted, Elizabeth. There you go.
Good evening, everyone. Thank you so much. And thank you, Linda. It's just an honor to be here. I'm a little tired, so just bear with me. I sent Linda a little PDF file, but that's okay. It's really the data that I'm just kind of referring to.
I can get it for you, Elizabeth, if you'd like.
It's fine if you want to. It's really just a lot of numbers and so forth. So basically, I felt that Maria has done such a wonderful job, speaking about challenges and so forth. And we are not any different, again, to being an immigrant community. I think that we have very similar, similar experiences and difficulties, and also to what Ken has shared just now in terms of Alice's household. So, Frederick is a wonderful community. We know that, it's just a really good place to raise our kids. Every community still have, their own challenges, and we are not, alone. So unfortunately, as Maria already pointed out, that we really do not have good data to share, with you, particularly with the Asian Americans, communities or residents here in Frederick County, because the data are not disaggregated. So what I try to do is really looking at the big pictures, and share with you, yes, from my heart about the experience that we have. Interesting enough, in 2000, the census, which in 2000, 2010, Frederick County's, the rate of increase, not the numbers, among the immigrant communities is the Asian Americans, down community. That was 20 years ago, right? And now that obviously, down landscape have changed, and we're, great to see that also to become more diverse. The Asian American community in Frederick is still about 5% of the population group, just about like in the States. However, it is really, to me, that probably like with the Latinx community too, that the census might not truly reflect, the true numbers of our communities. But we also have transit. The reason why I said that, not a lot, but then we do have them come to New York, down California, just because, for temporary purposes, and they will, be moved around. And that's more in terms of the, food industry, that they came to work and then they would move on. So, and then sometimes 6 months later, they come back. But the data, if you haven't, I'm just going to kind of share some data to say that as a country, we are not a monolithic group also, right? So in Frederick County, we have, about, I would say 15,000, even those 5% of the, it's about right, 5% of the county's 271,000. So, pretty much, close to that 13, 14,000, but I think that it's just more than that. But as a country, in terms of, let me just focus on two things to share with you about the, the impact of COVID and the livelihood that we have. One, definitely, the COVID-19 related outcome. As a country, we have 35% increase in excess of death, for the, first 7 months of 2020. This is about a year ago. And then the second highest increase compared to other racial group from the Asian communities. And then 50% high risk of the hospitalization and 50% high risk of, testing positive than white. So without data, it's really hard for us, but we know that at the community level, that every day, that we run into a situation, even one case is one case too many for us, right? But again, in terms of COVID among the healthcare workers, I don't have data. I don't know what percentage of, healthcare workers in Frederick, have Asian, but I know that, anecdotally in our nursing home, we have large numbers of Burmese, Filipino working in nursing home. So the healthcare workers, the death rate, to compare with the white population, the Asian, healthcare workers have a much higher rate, down to facing this, horrible disease. So I'm not suggesting, more it is in Frederick. Again, I have to say we don't have the data, but again, nationally, this is what happened. So the risk for exposure is because we have higher percentage of frontline workers, down working in, down healthcare setting. So the rate of increased exposures, can be higher. And also because, we have more of our communities living in a multi-generation household. So those risks of exposure, besides being a healthcare worker, is also higher. So that's something that, as the Maria pointed out too, I kind of refer to Maria because she said a lot of things that is just about the same with us. Then down we do have situation where we might have 2 or 3 families living in one single dwelling. So those exposures is very real, and it's just for us that working with our community and that just make it more vulnerable. And in terms of pre-existing and also about the conditions that we have hypertension problem, we have asthma problem, diabetes problem, we have smoking problem. Those are national health disparity among the AAPI community because of those pre-existing conditions also cause us to be more vulnerable to COVID. But other the factors, and I want to focus on a bit more on the barriers to access to healthcare. What is it? I think that down you probably can guess. It is a language barrier. So as an agency, we have 35 languages, and then besides Spanish, we are the only agency helping in terms of those other languages to the Frederick Health Hospital. The Burmese, the Korean, the Vietnamese, and the Creole French are the top down languages that the hospital to utilize our interpreters. So we know that those who are foreign born have higher risk in terms of access to care. And the other factor is fear of public charges. So that means that our community really want to publicly to ask for help because, it is so difficult for them, partly because they're afraid that they may get deported, they may get reported and so forth. So that fear is there. In terms of vaccinations, again, we have higher, percentage of vaccinations, I think across the state, across the country, but we don't know the subgroup. So again, so do not look at it as one group, but it's really not a monolithic group. So there are subgroup differences, disparity among the Asian communities. So in general, it is the risk of exposure, it's a pre-existing condition, it's a language barrier, cultural barrier, and then also the disparity in terms of subgroup and vaccination. Those are kind of COVID risk factors, right? But let's take a look at the livelihood among the Asian community or the Asians, the API community. So as a country, we have 6%, US population growth. And then, but our Asian American owners make up 26% of the food, accommodations in business, 17% of retail, and social services, and 11% education. So what is it in Frederick County? Certainly, our economic department can also, share more of those information with us. But again, it's an aggregated number. But you can tell, for those of you who went downtown Frederick, did you see more of the Asian? I just think that even year before last, we have, the noodle store. We have, the Korean, barbecue. We have many different, Asian business, also coming into Frederick. So that's to show you that we hire more people and they have more households. Sometimes people said, "Oh, Elizabeth, I don't know where the Asians are." And as you know, that I pretty much traveled throughout the state for health disparity work. And I said, "Do you have Chinese restaurant? If you do, that's 4 families right there, right? The cook in the back and the owners, or the server in the front, or the cashier. So they are there. It's just that they're kind of not quite visible. But because also the fact that in terms of our COVID situation, I would have to say that we find we have higher unemployment, particularly last year in our Asian American community, about 10.7% as a country. So, and the women also too, and many of them, and they lost a job, whether it's a factory job, whether it's just, the poultry job and so forth. We have high unemployment, the amount our group, but also the long-term unemployment as a country is 44%. Again, I don't have data to show you in terms of Frederick County, but I know that, they are suffering because we dealt with unemployment, we dealt with, that we got this, because of the language that we have, folks call and they want to get help. And then, they just don't, even though we have wonderful services in our county, housing assistance, food assistance, so forth, it's difficult to navigate that, that system online. So, we use our, what we call bilingual, bicultural community workers and to help them. So one other piece I really want to share, and just forgive me, my tears running down that you did not see. It's have to do with Asian crime, anti-Asian violence. As a country, we have about 3,795 anti-Asian incidents reported between March and February this year. And women are being, that have more, that 2 to 3 times more incidents. And those incidents include verbal harassment, shunning, physical assault, civil rights violation, and online harassment. I would like to, I know that this is my first time, my very first time publicly to let you know that most recently, we have a very difficult case that of a young man, promoting anti-Asian verbiage, let me put it this way. I do not know, I am not an FBI agent, I'm not a law enforcement. I could not tell you whether that will consider hate crime or not. But it stirred up a lot of, unease within our Asian community. And yet I have not yet seen anything being done. There might be something being done. I don't feel personally I can respond to that because I'm not the law enforcement. I'm not the school. I'm not, our, county city official. But I can tell you that, if you like to see, I'll show you. But I just want to tell you publicly that it's here. The anti-Asian violence is here in this county. And just even a couple smaller things is, our Asian elderly being, I wouldn't use the word attack, but harassed and being, pick on the pocketbook, the purse in H mark. So you can say that, that we are immune, we are not. And all this is because of this, right, this xenophobia about, Chinese, bring over, or China bring over the antivirus.
But can we have some questions now, Elizabeth, for you?
You want me to stop right here? I'd be glad to.
Yes, it's 10 minutes and maybe someone has a question.
I have a question again.
Yeah.
First, before I ask the question, can I just thank you for sharing that story? I think it's very important that we recognize the violence that happened in Frederick County. We can't ignore it. It is, we often like to think that, oh, these things don't happen in our neighborhoods, but they do. And I think it's very important to call them out when they do. And so thank you for sharing that. It means a lot to all of us. It means a lot to me, and it means a lot to Envision Frederick County. My question, I was going to ask another question about data because that's what I think about, but more focusing on that, is there something policy-wise that you think the county or the state could or should do to both address that violence and or help keep better track of data on health and wealth disparities,
Thank you.
both statewide and in the county?
Thank you for asking the question. And the answer is both. I think that, that we, those of us who work in the immigrant community, work long and hard. And we have to continue to advocate that, yes, our Hispanic community has the highest, the rising numbers. We need to really address the need. But doesn't mean that the other communities doesn't have the same need either. So then you will say that, they're too small and we don't need to, we don't have the money to take care of it. And I will not accept that. For those who know me, I will not accept that. So that's the reason why as an agency, we really try very hard. Because if it's one life saved, it doesn't matter. I'm gonna give you another example. I'm so sorry that I do that anyway, because I really tried not to be emotional about this. I have Chinese family who has a child back in kindergarten, was not quite well intervened, if I would say, with some mental issue. The child went to fifth grader and have manifested the big problem. Father brought the child back to China, tried to help and couldn't really do much, to the point that the father decided to end his life. And the child came back to Frederick, and that was better in terms of getting some attention. But even 2 days ago, I was in California, right? The child mother called me and said, she was brought to Brooklyn in Hagerstown. This mother by herself now, the father died, gone. And she had no transportation and she couldn't speak English. So I was really worried. I said, just wait till I come back and then we'll do something. So, like this one case, and this child is an American citizen, born in here. Why is it when she was younger, she didn't have the proper mental health intervention? And we talk about mental health. We are facing that, left and right. And so I can give you story after story about my Hispanic communities, hung himself, and Korean members, and all of that. We need mental health help. We need language access. So to let you know that it doesn't, to me, I will not accept because we are small. So there's no language in Chinese, in Korean for the COVID-19. It's on CDC, print them out, put them on the wall. So anyhow, as an agency, we can only do, and we'll continue, we're not gonna stop, to really promote.
You've got mail.
So I will continue to advocate for everyone who have language access to have that, because it's civil rights. I saw Irene there. It's our right. We cannot be deprived of services because we're foreign born. it is just not acceptable. In fact, my father, I know that people like story, I sent my father home to die. I'm a legal resident at that time, American citizen later on. My family is a veterans. My husband, grandfather went to World War II, Flying Tiger. And yet, because of pre-existing condition, I could not buy health insurance for my own dad, who put me through school and 5 other kids to become who I am. But I had to send him home to die. What kind of country is this? So I'm not considering we are a great super country. We need to have universal health care. We need to take care of senior. So those are things that we continue to fight together. The Ellis household, those unemployed, underemployed, uninsured, those are all very much part of the fabric of Frederick County. I appreciate the fact we have all of us talking from our own each perspective, our community, but together we have to make it stronger, advocate for each other's, not just one group versus another group. And I'm continue to say that we are invisible. This is a thing I just would like to challenge everyone. It's not, I would like to say your Black and brown community. Sometimes I find the uptick, in terms of the Black and Latinx, then I'm not counted. I'm not counted. I am. So, please stand up and fight for everyone, and that's all I can really at this point to share this story with you as you continue, that advocacy for each other's. And I thank Linda, Jill, I think really looking out for all of us and I appreciate it. I think there's so much to be done. It's a wonderful community we have. There's a lot to be done.
Thank you, Elizabeth. And that's a really good segue. I have been chatting with Willie on the chat back and forth. This session is intended to give us all an overview, and there is work to be done after this, and we will be contacting you for your ideas. So thank you. So our next speaker is Jay Mason, and Jay was elected to the Board of Education in November 2018 he's in his 4-year term. And Jay has been dedicated for years to serving the youth in Frederick County through various avenues, students through being president of Eliminating Achievement Gaps. And he is going to talk about education as a focus in the community. Thank you, Jay.
Good evening, everyone. Hello. Thank you, Linda. Hi, everyone. Good to see you all. Many familiar faces on here and some I haven't met yet. Looking forward to the day where we can meet. So when we talk about education, we talk about family history. And some of our families are not fortunate enough to have parents that went to college or promote going to college.
How are you? So I'm sorry.
Just don't have the background to help their kids get further into their education. Some families don't have the resources to advocate for themselves, and it holds their kids back. So, that's part of our school system and community organizations like the ones we have on here to help those families to make sure that they know that there's support out there, that education is fundamental and key to a successful adult life, family life, moving forward in the community in this country. And we as community advocates have to make sure that the families don't have those resources, don't have that background, know that we can help their children get forward in our school system, in our life, in our community, and making sure that the families know there are opportunities out there. And when you don't have access to opportunities, things get a little bit more difficult. And for our students that aren't given the access to those opportunities, it really holds them back. And we have to, as a school system, make sure that we are providing opportunities for all of our students and not just our highly able learners. Every student is capable of learning. We need to have a focus on making sure that kids know they can do it, not trying to hold them back because we don't think they can. We have to really encourage our students to make sure that we are pushing them and not holding them back. Had a visit today with a couple schools, And I heard that same very thing. And the principal moving into that school said, we're not going to allow that. We have to make sure that our kids are getting the opportunities they deserve, even if some of their former teachers don't think those opportunities are available to those kids. And so, you know, we have to make sure that we're changing the mindset of our educators in our buildings. And I know as a school system, we try to do that. And I'll give you some examples here in a little bit. So one of the guests on here, Cindy Powell, I think there she is. Hi, Cindy. When we talk about opportunities and access, we have the Housing Authority, which I used to volunteer with a few years ago with Cindy, a tutoring program. Monday nights was math, Thursday nights was reading. And being a math guy, I was very willing and able and excited to go over there and help the students. And with community organizations that help our students outside of school, to make sure that kids know that they can do it. And I would give the 4th and 5th graders some challenging math problems that I got from the middle school math counts competition. And the kids were first reluctant to try them. But once they figured out they could do it, it was exciting to see those little brains understand the math problems and the smiles that came afterwards that really showed them that they could do it. And we all just have to make sure that we are just providing every opportunity, supporting those kids in and out of school. And I appreciate all the community organizations that do that. It was a wonderful experience coming over there with Cindy, and I know she's still doing it. She did it through COVID. She had a couple centers over there for our kids during COVID. When you're in a house with 4 or 5 children and the internet is not great and school's all virtual, it really has an impact on the kids' education. It really slows them down. It makes it difficult. Big brother, big sister are trying to help little brother, little sister, and it holds them back. So, you know, I really appreciate the opportunity that Cindy provided for the kids at the Housing Authority to keep those kids going and keep them motivated through COVID. And it's a true blessing. And I appreciate that all that she did for those kids. And she's been doing it for years. It wasn't just during COVID. It's been a pleasure to work with the Housing Authority for our students. One thing that we've been working on at the school system is increasing our population of teachers of color. When we have a more diverse teaching population, teaching staff, then that is going to help our students of color to be motivated to have school and to see someone like them in the school building, someone they can confide in, that they know someone has been through some similar situations, what they've been through. And we are getting better. We have a long way to go. I know that we are going out to different Black universities to make sure that we are trying to recruit more diverse teachers. Part of the problem is the teachers aren't there. We can't create something that's not there. So we are making every effort to recruit teachers, but we have to grow them within. So we have a teachers academy in FCPS to help grow a teaching population. It's not always easy to attract people of color to Frederick, as you saw from Ken's slides and from what Maria said. The majority of the population here is white. So it's been difficult to recruit teachers of color to come to Frederick. So we are trying to grow our own with our Teachers Academy, and somewhat successful. I think we have 2 of the 8 right now in the Teachers Academy that are African-American students in FCPS. We have focused on reducing our suspensions and our expulsions. And we do that through our restorative practice, restorative circles, to make sure that kids are staying in school. One thing we do know is kids don't learn when they're out of school. So we have to make sure that we are keeping them in school so that they are having the opportunities to learn. Restorative practices, let's say a kid does get in a fight, they will get suspended for 10 days. They go through a restorative practice, restorative circle with the person they got in a fight with willingly. And if the restorative circle is successful, they can reduce their suspension time from 10 to 7 or 10 to 5 days. And it really gets them back in school earlier. It gives them an opportunity to talk to the kid that they got in the fight with so that we can restore their relationship and try to build their relationship. I've been to a few at Ballinger Creek Middle School, a few training sessions, and the stories that have been told are great. And sometimes the parents come in and join in the restorative circle, and they're very, they have a lot of animosity when they come in, and they can leave the room hugging each other and exchanging numbers and really helping to build a relationship between their students. And it's good that the adults can be involved so that they are setting examples for their students. Some of the examples that, and you can find them on our website. I went through our website one day just to see what we are doing to help our students to have a better school system. One thing we have is a Vanguard program. Vanguard is our own created teacher program. One example that I heard a few years ago was a teacher that was at Linganore for 18 years, went through our Vanguard program, which is a 3-year cohort. And after the 3 years, they graduate, move on, and they become teachers of Vanguard. But this one teacher was 18 years at Linganore High School. And after the 19th year, she went to Frederick High School. And that is a very big big difference in schools. Linganore is not very diverse. Frederick, one of our most diverse schools. And this Vanguard teacher, a lot of our Vanguard teachers are rejuvenated even after a long teaching career. She was really excited to share and be a part of the Frederick community after being so many years at Linganore. And it's really good when you see a teacher like that, say they're reinvigorated, it's almost like year one for them teaching, they're excited, and they're going to Frederick High, where we have a very diverse population. And they like to, that teacher was just excited about being at Frederick High School and working with a lot of minority students, which she had not done before. We have a young,
one more minute.
okay, we have a Young Scholars Program through Hillcrest that teaches our young kids about some STEM activities. We have links at Frederick High, which allows kids to work. They can come to school at 10 o'clock and start their first period class. They can have 4 periods throughout the day till 5 p.m. It allows their schedules to be adjusted so they're not waking up at 7:30 after working very late. We have CTC, we have dual enrollment. We have many opportunities in our school system that allows kids, allows the school system to meet kids where they are. And I think that's very important. We can't teach in a box, in a circle. We have to meet kids where they are. We have to be flexible, innovative, and I appreciate that we have put in so many great programs to help our students succeed and become a better school system.
Great, thank you. I'm going to tease Sam and say, Sam, another person is going to get a question this time.
Yeah, no, yeah. Willie has had his hand up for like ever, so he gets the question.
Willie, go for it.
Thanks for your deferral to allow me to speak. Regarding several things. You talked about minority teacher hiring, and I heard you talk about going to, I guess, African-American universities or colleges or whatever. I have been looking at this issue for over 20, 30 years. And what we have seen over the years is that has not been a, well, let me just get to the root of it. In terms of minority teacher hiring, it's been there, continues to be there. We have gotten data from the Board of Education, and that data has shown that minority teachers are applying, but they are getting rejected at a rate 3 to 4 times that of non-minority teachers. Let me repeat, the minority teachers are applying, but they're getting rejected at rates geometrically greater than the non-minority teachers. So it suggests to us that we need to look at the application process. Why are they getting filtered out? Why are they not making it all the way through the system? And we propose this. We propose that you look at the application of minority teachers over the last 4 or 5 years who applied and who were eliminated, and see where they were eliminated. And if you can find out where they were eliminated, then you can begin to address the obstacle there. We all know that all the students benefit from having a diverse teaching staff, not only minority students, the non-minority students. We all agree to that. The data supports that. But we keep hearing new programs, and I've heard quite a few new programs over the last 30 years. But we end up with the same result, in that the teachers are not being hired, although they are applied. And let me just say this, if you are graduating from Towson and your roommate, you are a senior and your roommate is a junior, you graduate, you apply to Frederick County, you get rejected. Your roommate who's graduating next year is not going to apply. They said, I'm going to go somewhere where I am going to get hired. So we got a legacy that we're dealing with here. And we have to look at that. We got a legacy in a lot of things in Frederick County, but just on that, we have a legacy there. So what we need to do, we need to look and see where the ethnic minority teachers are getting eliminated in the process. There's no such thing that minority teachers won't come here because it's a white community. That's ridiculous. When you get out of school, you go in where you can get a job, okay? And if you're concerned about kids, you're going to go where you can work with kids. There's this excuse that minority teachers don't come here because the pay is higher. Well, I don't know anywhere in America where Black folks are used to getting paid more than white. If the white teachers will come here, the Blacks will too. All of these excuses, and what happens, our kids are victimized by it. Our kids are continuously victimized by all of these excuses and canards as to why we don't have minority teachers. What we need to do is look at the selection process. You would do that anywhere else. Just look at the selection process. I want to address another issue in terms of suspensions. The primary problem has been the long-term suspensions. Those are the suspensions where the kid out of school for 10 days or more. The kids have a right to have those things addressed procedurally. None of those suspensions can occur but for, unless they change the regulation, but for with the approval of the superintendent. And so if we're going to talk about school to prison pipeline, that's where the school to prison pipeline really kicks in. And what we need to do, we need to see the data in terms of whether there has been a real improvement. I mean, we have nice programs, but we want to evaluate those programs to see whether that's been a real improvement. We can look at that data. In terms of
Willie, can I break in and let's see if Jay has any information on any of those topics?
Well, let me finish my last one. You can give them all at one time.
Okay.
In terms of the access to education, Jay talked about the dual enrollment program and CTC. Those are great programs. My daughter went through dual enrollment, and you can see how much she benefited from that by being involved in a college program. It really helped. The question is, what is the participation of the ethnic minority students in those programs? I mean, those are the questions that resound when you start talking about curriculum content. Where the minority students, are they placed in the honors classes? Are they placed in the most challenging classes? Are they, I hear Jay talk about what happens outside the classroom, and I've done tutoring and things of that sort. We want to know what's happening inside the school because we are taxpayers. And so we deserve to have our kids educated. I'll hold up right now, but
okay, yeah, because we're going to run out of time. So
well, we got to make time for some things. We have to make time
I
for something.
understand. I
All right,
understand.
okay, all right, okay.
Thank you, Jay. Anything that you wanted to add to what Willie asked about?
Well, Willie, I was asked to talk about the learning challenges of the minority community, and I added the school part. So we also, on the application process, answering the race question, applying for race is optional. So not everybody fills in what their race is. And Willie, if you have that data, I have not seen the data on who's applied. I'd like to see it because I know we've asked for it and I haven't been given it.
Well, they gave it to me.
So
They gave it to me. They've given it to me historically. It's not just now. They've given it to me historically. I've been getting it. I've been getting it, and it came from the board. It came from your folks.
I understand. I've asked for it, so I'll ask again. I know when I saw the when I joined the Racial Equity Committee, we got data on suspensions, expulsions, and they were way down. And I can possibly share that data, but I know that we are not suspending kids at the rate that what we used to. We're focusing on keeping the kids in school. I don't remember any other points that were made.
Well, I talked about access. I talked about curriculum access. What does your data show in terms of like programs like the baccalaureate program, honors program, dual enrollment, CTC? I mean, those are issues that goes to the quality of education that the kids are getting. And that's certainly germane to the entire population. If we're going to talk about equity, that's certainly on the view for equity. Those are things that are important. I've gotten that information over the years. I haven't gotten it updated, but I can tell you, in case you haven't gotten it, Jay, I've got it over years, and I can tell you it is it's not pretty. It looks like in-house segregation to the extent that the African American students are not involved in some of the most substantive programs. And so
I don't disagree with that.
No,
I don't disagree with that.
I don't want.
Okay.
That's why I'm here.
I don't want you to agree or disagree. I want some plan. I want something to happen about it. I mean,
Okay.
I want something to happen about it because we're talking about equity.
Can we get to the next speaker, please?
Right.
Me and you can talk about this forever.
I think we'll have a whole follow-up session. I think we see one brewing here. I know that Danielle prepared information for us, and I don't want to let us get away without hearing her wonderful information. So we are very lucky to have Danielle Haskins here, who's the program manager for the Frederick County Health Department's COVID-19 testing program. And she is also the department's equity lead, and she is going to give us some information about impacts of COVID on all of the underserved communities. So Danielle, go for it.
Thank you. Again, thank you for the invitation. I know there's going to be some follow-up conversation because one thing Mr. Mahone has been is tenacious, definitely. Let me go ahead and share my screen.
Got it.
We have it. Okay. Do you see the presenter slide or the main slide?
Enter.
Presenter. Thank you. This
Don't actually have notes on the slides. If you go back into the view, I think in that view, there is something called display options that you can change back to like normal view, and you would see the normal view that we do.
Gotcha. Okay, let me try this again. Are we good?
Yeah, I think if you do presenter, I think we're seeing your notes right now. Maybe if you click on present online or from.
So what you said, when you press from beginning, it gives you this. I've never seen that before.
Yeah. And I have
You
it
have,
on.
you have two monitors.
I do.
You know, so if you go back to the settings you're using just prior, can you do that?
The challenge I have now is it is completely, there we go. Okay, so it's switched my Zoom.
Hey, Danielle, you want me to try it?
Can you, Sean?
Yeah, let me give it a try.
Thank you. What happens when
Oh,
you
it just
do-
says you'll have to stop sharing to allow me to share.
So my Zoom disappeared. What happens? Oh, here we go. That's where there's my, when I use Teams all day, Zoom is now foreign to me. Sean, do you have it up?
I'm getting there.
Awesome.
How's it look?
We're good.
All right.
Everybody sees the right thing? Okay, sorry for the delay. Thank you. So again, thanks for the invitation and the opportunity to be able to talk, because as I agree, this is an important topic and sometimes we do have to make time. I appreciate that. Looking here, and I'm sure I see a lot of familiar faces. I'm sure you've all seen this screen before, or many of you at least have seen this screen. This is the disparity data from the 2019 Community Health Needs Assessment that's done every 3 years in collaboration with the Frederick County Health Department and the Frederick Health Hospital, among other community and faith organizations. And really what this is here to show is that for every indicator where data is available, I know we had a lot of conversations about data, disparities do exist. You'll notice that there are some things there where county level data is not available. And so data interventions, obviously they're the focus. We should always strive to be data driven. But I think it's also important that we have the conversations that we're mindful about what we're asking. And a lot of times we have a lot of big data, CDC data, which is fantastic, it's accessible. But what about the small data that tells our specific story and that really allows us to have meaningful impact? Next slide, please. Again, social determinants of health is not a phrase I don't think that's new to anyone. I do think it's important in this conversation. So looking at the personal connection, this community support, and then really the systemic changes that need to happen to address some of the health inequities. So health inequities being the systemic differences in opportunities that groups have to achieve optimal health that leads to unfair and avoidable differences in health outcomes, and not just health in the absence of disease, but health, overall health, our mental health, our physical well-being, and how those play in together. And then we have structural inequities that are personal or interpersonal, and the systemic drivers that really make those identities significant when looking at the fair distribution of health opportunities and outcomes, the isms that we're familiar with, such as racism or sexism, classism, and how all of that works together. Next slide, please. So in addressing health equity, I know we're often we'll see the pictures of the people on boxes and the 3-level boxes. And I think this really kind of drives it a little bit deeper. So looking at inequalities that will favor one side with more resources than another, and moving towards equality where the same tools are given irrespective of the difference, where the different resources are. And then the conversation that we have often on equity that provides tools provided to target which each individual needs, and that targeted being an important word there. As we move to justice that corrects the system, and it's really systemic issues that we need corrected, and that allows us to distribute the resources and provides targeted tools and interventions so that everybody can have a fruitful life. I think a lot of times that we do a disservice to communities by lumping together minority in one, because we know there is not a one size fits all. There are historical concerns and there are present concerns within each community. So I think it is important that we do separate out and we work with those communities to be able to find things that will work for them. Specifically, what works for the Black population may not be what works for the Latinx population. And if I'm going to be honest, I don't think it's fair that we say, minority communities when we're looking at solutions, because I think we're able to really dig in and do a better service to our community by separating those out. Next slide, please. So always looking for actionable items and what can we do, moving forward. Obviously making health equity a leader-driven priority sounds simple, but making sure we really do have the buy-in from the leadership and we are walking the talk. We're not just asking, we're not just making declarations and not keeping the accountability part also. So making sure senior management articulates the vision, but also acts by putting the funding, towards equity, that we're able to develop structures and processes that support equity. So dedicating, again, the financial and informational resources accordingly, as well as setting up governance structure that oversees and manages across the organization to hold accountability so we can share the data that we have. So the community can look back and engage us. How are we doing? We say that this is important to us. How are we proving that? Taking specific actions that address the social determinants of health by first identifying those disparities. So where we know we don't have the data, what do we need to, what do we need to collect that? What questions are we not asking? And how are we not able to fill in the gaps because we don't have that information? And I think important part is confronting institutional racism within the organization or within our systems. So racism, whether it's implicit or overt, is an independent driver of poor health. And we see that, for example, when we look at Black women and the outcomes for maternal child health. And this is irrespective of their education, of their socioeconomic status. So race is the driver, in that one and many other situations that needs to be attacked emphatically and very specifically. But most importantly, I think none of this is going to be possible without partnering with community organizations, and not only partnering with community organizations, but being led by community organizations and supporting them. Supporting them in getting into the root causes. They know their history, they know what's going on now, and among them, really allowing them to tell us, what support they need so that we can help them move forward. And I know all of that was really, really quick. I didn't want to take up, I wanted to be respectful of everybody's time. I know we're over the 8 o'clock hour.
Thank you, Danielle. I know that I'm sorry if you had to shorten, but I don't know how people feel about sticking around till 8:15. We've had a lot of ground that we've covered and we might want to do some discussion. And I know board members on this call were already talking about we need to dig deeper into all of these topics. So you can look forward to that. Questions for Danielle about health disparities?
Willie, your hand's up. Did you still have a question? Because I have questions. I always have.
I wanted to address actually really quick, not to just, not let you have your question. I think what you said before was really important about the hesitancy information that we have, right? So I can tell you that the situation in Frederick County is not what we're seeing statewide. And I think, again, that goes back to the support that we've had through the community and really working with our community organizations. I know we have to be careful because saying these populations are hesitant are then going to place stigma on those same populations. We're going to do a disservice. And what we see, at least here in Frederick County, is that where our minority populations are actually the higher vaccinated populations. In Frederick County, our white population is vaccinated at a lower rate. We do have concerns or people that are filling in, reaching out saying that they're, asked for vaccine identification. They feel like they're being profiled. So I think we definitely have to be cautious on that. And I just wanted to speak to that, Sam. Thanks.
I
right?
have-
Because I mean,
Oh, go ahead.
do you have a question?
Well, I was just going to pick up on that because I was curious whether Danielle and Ken, whether your data is intersecting in terms of the Alice population and who's unvaccinated, since there's so many in the county that are Alice.
So I think the Alice really brings out like some of those rural communities, right? Like looking up in North County and those pockets of poverty there. And really it's, you know, the limited resources where they are. So we worked very closely through this response with the United Way. One of the biggest success, I think, was bringing back, we never really provided a name for ourselves with the census team. There were over 98 organizations represented, and that allowed us to provide education and information to both the official and unofficial leaders, so that the trusted leaders are able to then, you know, provide real-time or information. And if they weren't, then they knew how to get a hold of us at any moment. So I think it did coincide.
It did. So if you were to align the census map that Danielle and Sean and the health department produce pretty frequently, and you were to overlay that map over the Alice map, it would be almost exactly the same. The same communities that have concentrations of Alice households are the same communities that have higher concentrations of vaccine hesitance. It is almost exactly the same.
Sam, you had a question? You're on mute.
You muted.
I thought I hit the button. My bad. Okay, so before I ask my question, I just want to acknowledge that there was a question in the chat that has been answered a few times. I just want to make sure that the person who asked the question, I have it as Galaxy S20 plus 5G. Very good name. I think it's a great name. But that question has been answered, and we'll share that answer, of course, when we send stuff out. So my question, again, going back to data, right? Okay, so this might be a little bit of a wonky question. So, but maybe not. So there is a need for data. I think most people expressed a need for data, but there's also, of course, a danger of retaining data that categorize people by race or ethnicity, right? How can a legislative body or a agency, whether it be state or local, navigate that in a safe way, right? Because if we're trying to advocate for policy solutions through to our reps, right, we want to make sure we're not setting them up for failure, whether it be practically or through the courts, right?
So I think first and foremost, there's going to have to be time dedicated to that. It's not something that's easy, and I say that because what we need is not stereotypes and self-identified data. I mean, I can tell you, I have tickets that say I'm Asian, I'm white, I'm Black, you know, a little bit of everything. I identify as a Black woman, and if you don't ask me that explicitly, you don't know that. So collecting that data based on how people identify, but also what I've found just with this COVID response is the race and ethnicity. The separation of race and ethnicity isn't as clear to some people as it is to others. So it's important that when we present data, we present it in a way that's understandable for all parties, and what the data is saying and what it's not saying, making that clear. So not only having the data that's accessible, but making sure that we are also providing a narrative around that data. So in my opinion, policies, back to your question about how can we help create policies, I think the more that we can fund the community organizations or faith organizations that are providing services to the population we're interested in collecting data to, those are the leaders, those are the people that should be collecting that, because the people feel more comfortable with them already, and they're more familiar. It's the more equitable way.
Maria,
So
did you
I
want to
failed.
add to that?
So Linda, I failed to tell you what the sources of the Alice data are, and it's about the strongest data that's available nationally. So the data from for the ALICE report is from Census Track, American Community Survey, and the Bureau of Labor and Statistics. It's about the strongest data you'll find anywhere. Unfortunately, there are gaps. For example, there is not strong census or Bureau of Labor and Statistics data on veterans, for example. So we are unable to provide strong data on ALICE and veteran populations, and that is something that we've been complaining about for a very long time. Unfortunately, well, federal government isn't always very good at disclosing data they're not very proud of. So we're working on it.
And to add in one more reference, I think, Sam, you're in Baltimore, the Baltimore Neighborhood Index Alliance. Baltimore neighborhood, the BINYA, I'll get the information correct. I'll snap it in the chat. But that's something that's been headed by the University of Baltimore, but it collects that specific neighborhood data, but it's labor intensive. It's going out and talking to the communities face to face. It's those personal connections. And I think that's something that has been successful, and it's something that we can look to as far as precedents, but definitely needs the support.
Sam, I just want to share with you that as recent as just last year, and as a country, the Office of Minority Health really has put a lot of the resources to looking at what we call cultural relevancies and language appropriate services. And so, one of the projects we have is really, like Danielle saying, that you need to really get to the community that people trust, but at the same time, community needs training. So, that here we have, the project with about 10 different languages, just looking at, COVID information, having a piece of information can community really fully understand and use it and, to really meaningful to them. So I think that at the policy level, at the national level, there are movement looking at data, down literacy as well as health literacy. Those two literacies really becoming, a very, hot topic for those of us in public health, which is great. We really need to, today we might be talking about COVID, the languages, but dealing with that, but tomorrow can be, diabetes and hypertension. We have to really get the information out so that the community can fully understand what that means. So then they can react to it. Then you can collect the data. So again, going back to really empowering the community at that level so that they can be trained and equipped to assess, to really work with community and get the right information and be part of the data collection. So I think this is the trend that I'm very happy to see after 50 years in public health is getting there, but it's not there yet.
So I think we have time for one more question for any of our speakers.
Linda, this is Ken. I do have something I want to show. So Sean Dennison was kind enough to send over the vaccine map, and I was able to pull up the ALICE report so that we can look at the ALICE report next to the vaccine map. In both instances, the darker the shade, the higher concentrations of either vaccine hesitancy or the higher concentrations of ALICE households. So almost exactly the same, with the exception of the city of Frederick, generally speaking. And I think that's because they've done a really outstanding job in the city of Frederick with vaccine access. A little harder in the rural communities.
Mm-hmm. Anybody else want to ask?
Cool,
or is
I'll
it
take
just
that down.
getting late in the day?
Ken, did you share it? I didn't see anything. Is that just me?
Did anybody see it? I shared it.
Oh, I thought you meant you were going to send it along.
No, I shared it. I'm sharing it right now. Can you see? Oh, wait, I forgot to hit a button. There you go. Sorry about that.
Right, okay.
Interesting, yes. So we do, while we're looking at that, we do have one more question from Willie. Willie, you want to go ahead and wrap us up here with your question?
No, it was not a question. I just wanted to commend Danielle on the excellent work that she and Dr. Brookmeyer have done over the last couple of years. on these issues. And the fact that there has been such participation, particularly in marginalized communities, are to be attributed to their efforts. And I just want to express my appreciation for that.
Thank you very much. But again, it's working with, you know, Ken and Cindy and Elizabeth and Maria. Literally, you guys are the heroes for sure.
So it is an interesting story. We had a model through the 2020 census. So we were part of the United Way helped arrange and coordinate the complete count committee. When the vaccine campaign came around, we decided we already had an existing model, right? Why reinvent the wheel? We brought the band back together and pulled all the nonprofits in to get the word out about vaccines, and has been extraordinarily successful.
I will agree with that, Ken. Thank you.
Yes.
So I'm really glad that everyone was here for this, what I feel turned out to be a very broad brush overview, because we could spend a whole session on each one of these, and perhaps we will. Karen's going to tell you in a minute about, remind you about Saturday, but I will say that if you want to send an email to linda@envisionfrederickcounty.org, if you're interested in a particular topic, you know, maybe we can do another webinar or have a conversation group around it or something. I think that all of this, we want to do what we can and do the right thing. And sometimes we don't always know what the right thing is. And I think it's worth talking about. So with that, I really appreciate all the speakers coming tonight, and I'm going to turn it over to our board member, Karen Tome.
Yeah, wow, what a fantastic group of speakers, you guys. That was wonderful. What an immense amount of information you guys brought to us. So thank you very much on behalf of Envision and the board. Thank you very much for all those presentations, and thank you to everybody for taking the time to come out tonight to this to the meeting. We did want to remind everybody there is a walk with the Arch African American Resources Cultural and Heritage Society at Mullinex Park, and that's going to be on at 5 p.m. on Saturday, October 2nd. If you do have to use the garage, we do have, I think, 10 passes. And I think Linda's going to be able to make those available at the
yes, they're vouchers, and if it's for the parking garage that's down along Patrick Street by it's not the courthouse garage, it's the next one closer.
Yeah, the other side. Yeah.
So I have vouchers. If you come up, you get a voucher, and when you leave, you give it to them, or you put it in the thing, and you'll get out for free.
Yeah, but yes, you guys did a fantastic job. We really appreciate it. Really, it's nice to see some old faces here. I'm not old faces, but old friends. And, so anyway,
good friends.
Yes, thank you.
If I can cut in too, this is Sam again, your local question asker. I'm also a member of the board, right? And I would like to also echo the thanks to all of our speakers and all of our attendees. This will be an ongoing conversation. I'm sorry for like doing other things too. Law school life, y'all. But you know, this is you know, one of the things we did in Envision was we definitely realized that we need to embrace the conversation on equity, on both on health, wealth, educational disparities that are faced state and, you know, statewide, but also specifically in Frederick County, because it's unique. There are different populations in Frederick County facing different challenges. And so we need to have conversations about these. This was an overview focusing through the lens of COVID, and we appreciate the conversation, but looking forward to future conversations with you all. And we love to hear ideas about how we as Envision Frederick County can help, how we can further the conversation, and how we can partner with folks to actually make change, right? Actual change, like leaning into emphasize the importance of actual change, right? And so that's my note. I'm looking forward to future conversations about how we can actually move the ball on it.
Well said. Thank you, everyone. Have a very good evening. I
Thank
hope
you.
Hope to see you Saturday.
Yeah, thanks so much.
you.
Thank you very much.
See you later, everyone.
Bye.
Take care.
Bye.
Bye-bye.